thank you and welcome back to my channel. Today I wanted to come back with you and talk to you about my nipple-sparing mastectomy. I have taken down a few notes, so I'll refer to those back and forth a little bit just so that I won't forget any important information that I wanted to review. So let's go back to the month of October when I was not able to receive my chemo. So the tumor board met and decided after 3 weeks of me not being able to receive my chemo due to my white blood count being too low, that the decision was made that it was time for me to go ahead and get my left breast nipple-sparing mastectomy. With that being said, they met and decided that, you know, the tumor was small enough in the 2 meter range that I was a good candidate for the nipple-sparing mastectomy. And when we did when the ultrasound was done and they reviewed it, the tumor was still shrinking, so that was good. But we had to get ahead of the game. What is a nipple-sparing mastectomy? So the nipple-sparing mastectomy is when they go in, clean out all of the tissue in the breast, and save the nipple. Now with me, I am still waiting pathology on my mastectomy. I'll go back to my doctor's on November the 17th and I'll get the information on that. But one of the things that I would like to say is that I had no pain. Everything was fine. Everything went well. And she did a really great job with the incision that was done underneath the breast, which is called the lateral incision. So with the lateral incision that she did underneath the breast, it looks pretty good. So I'm not going to worry about the incision right now at this point in time. But what I will say is that the only pain that I would, and I wouldn't call it pain, I would call it being uncomfortable, is the drains from the incisions of the lymph nodes. They went in and they cut to do, well actually they went in to cut and check the sentinel lymph nodes, and I did a video on that real quick when prior to me going into surgery. And then they also of course had the drains in for where they did the mastectomy. And that was the most uncomfortable thing because you're trying so hard to get comfortable, and you have these tubes and you hook the tubes up to the side of the bed so that you could try to sleep in the bed in the hospital. Is so uncomfortable. And it's not a hotel stay, so that I'll say for sure. But moving right along. So I already talked about the nipple-sparing mastectomy and what the nipple-sparing mastectomy is. I told you why I had to have it so soon, and that another ultrasound was done to make sure that the tumor had shrunk in the size that it needed to be in order for them to be in the safe zone to do the mastectomy. Because a lot of people think that, oh, you can just go in and have a mastectomy. No, that's not how it works. Every cancer is different. Every procedure and how the doctors decide on your treatment is different. So it's not one of those things where you can just go in and say, oh, just go ahead and give her a mastectomy. No, that's not the case. So why did I have a nipple-sparing mastectomy? Again, the tumor allowed me to be able to have that. I was in the safe zone for my doctor to be able to spare my nipple. Immediately after having the nipple-sparing mastectomy, I received a breast implant. So it looks like a normal breast, but it's just now I have an implant. And I'm pretty happy with it right now. I think we might still have a little bit more work to do, and I will have to heal from this. So for 3 months, I will be wearing this. I have a special bra here I'm going to show you. So for 3 months, I will have to wear the special bra all day for the first month. Right now, I will have to wear this every day, all night. And then I have a special belt that they gave me, and the belt ties above the bra, and it pretty much holds the prosthesis in place, or the breast implant in place, so it doesn't slide or move or go around in different areas. With that being said, of course, I have to sleep with that on every night too. So it's all uncomfortable, but I'll take the uncomfortableness with having this removed and knowing that I can at least be halfway through this race and trying and beating this breast cancer, and knowing that I feel better with it gone. The next thing is that, you know, I'll heal. And I have my follow-up with my doctor on November the 17th. And we will proceed in how the healing is going, what everything is looking like. And then we will move on to me doing my last 4 treatments of my chemo. Not the previous chemo that I was receiving, because I did 10 of 12 cycles of that one. Now I will be moving on to the Erubicin and the cyclophosphamide. Those are the 2 that I will be moving on to. And again, I would do that treatment, 4 treatments every 3 weeks. So that's the plan at this moment. No one has spoke of radiation. Going back to the surgery, while in doing the surgery to remove the tissue from the left breast, my surgeon did check my sentinel lymph nodes to ensure that the cancer did not spread. That was the best news that I got on my way out of the hospital, is that it had not spread. None of my cancer has spread since I've been doing my treatment and upon first being diagnosed. I don't think I've ever said that in any of my videos, but my cancer is localized. However, it is staged at a G3 because it is aggressive. I don't have a staging for my breast cancer due to the fact that once they did the biopsy with me on the first surgery, taking a part of the tissue reduces the size of the tumor, which means that based off of the size of the tumor, that's how you get your staging. And so for me, there isn't a stage, but because of the type, then, you know, that's where we are with that. Once I go back and she checks the breast and see how we're healing with that, it is a little bit smaller, but if there is any way that it looks where we can get it to be like the right breast, then we'll do that. And how we will do that is she will remove the fat from my stomach and place it in the areas that it needs to be placed in within the breast. So I'm pretty happy about that, and knowing that she cares, because guys, I got to tell you, when I first saw that, the left breast was very, very much smaller than the right breast, and I was livid. So in the hospital, I had a breast care nurses, and the first breast care nurse came in to remove the bandages and clean everything up the day after the mastectomy. And she took pictures. So I said, okay, well, if you're going to take pictures, I want to take pictures because I want to see what it looks like. It was not what I expected. Oh my God, it was not what I expected. I was like, I came in here and I'm going to leave out worse than I did. And not in that perspective, but in the vanity way of what it would look like, not versus the health and a life-saving procedure. So I felt some kind of way about it, and I asked the breast care nurse, why was it so small, smaller than the other one? And she said that I would have to ask the doctor. Well, she didn't give me an opportunity, because as soon as she left out, she told her that I was not happy. About 35-40 minutes later, through the door came my doctor, and she said, "I heard you did not like your breast." And I said, "No, I do not like it." And she says, "Well, just give it some time. In a couple of days, it will get better. It will look better." And truly enough, yes, it did. So, again, I went into the hospital on October the 28th, number one, prior to the surgery, to have the sentinel lymph nodes, the radiation dye. And then the following day, October the 30th, was my surgery. I did not leave the hospital until November the 6th, that Friday. Now, the reason why I was not able to leave was due to the infection of me and my low blood count. They wanted to make sure that I did not have any infection. So they did not want to release me to go home. I had to stay there the whole entire 8 freaking days. But I had to be, and I had to find a way to put that energy in a different place of knowing that I was going to be there, and the reason why I was there for my healing, and number one, to get better. So it was hard, but the tubes, the drains and the tubes that I had, they had to ensure that those were not going to get infected. Now, a lot of ladies or men, you will go home and have your mastectomies maybe the next day. Some people do it different, and maybe you might have it the same day and go home. I don't know. But because of me and my low blood count, they did not want to risk the fact that I would, have an infection that they could not turn around. And then on top of COVID, that was another thing. So being there, it made them feel more secure. I received antibiotics three times throughout the day. I can't complain. But prior to chemo, if I would not have had the chemo, then I would have been fine to leave within, maybe 3 to 4 days afterwards. So I did good to have the drain that was in the lymph node to be gone 2 days prior to the drain for my breast to be gone. So on the same day that my drain was removed from the breast, from the mastectomy, was the same day that I was able to go home. So the breast care nurse came in and cleaned everything up, and I was able to go home, and it felt so much better. Even when I had the one drain to be taken out from the lymph nodes, it felt so much better. I felt like I got better rest. So, and removing the drains, it didn't hurt. Everything was fine. She talked to me the first time, and I didn't really know what she was doing. And then when she pulled it out, I was like, oh, now I know what you were doing, because she'll talk to you a little bit and then she'll pull it out. And I had to get down to 20 milliliters in order for me to be able to go home inside the drain. So every day they came in and checked the drain, marked it to make sure that I was at that level of being able to have the drains taken out. So now I'll go into the bra, and what I'm wearing right now, I do have on, I have the bra on. Well, anyway, I'm not going to go with that part, but I have the bra on. I'll show you guys a picture. But this is what I have. It zips up. And not only does it zip up, but it has the fasteners here. It has the little fasteners in here. Okay. And with that being said, it has the snaps. So you can put this under your arm and over without being uncomfortable with trying to stretch your arms. I'm fine. I can stretch my arms. I have, great range mobility because, of where the breast implant was placed. So again, I'm wearing this, And not only am I wearing this, it goes over here, and I have the band that straps across it as well. It's a little belt. I said band, but it's a belt, and it Velcros the same, and it has to stay here on the top so nothing shifts and nothing moves. Again, this one is much better than the one that I have on. This one is made out of a different type of material. This is more breathable. And, you know, just to have this on all day long, you guys, I'm telling you. Yeah. But I really can't complain. Home care. Once I got home, I was able to take a shower because I was not able to shower with the drains in because of infection the whole time that I was there. I had no shower. I didn't have a shower. So, of course, you know, managing the best way that I could to clean myself up, you know. But once I got home, well, actually prior to discharge, they were saying no soap and no cream on this side. I can shower the rest of my body with soap, but this side I cannot. This is the left side is only water. So that's where I am with that right now. And I have to do that for 1 month until the site is healed and much better. So to ensure that I don't get an infection, I am following the orders that I have been given. But it did feel good to get home and take a shower, a nice, warm, hot shower. And that's exactly what I did. But other than that, everything is great. I don't have any complaints. I don't have any problems. I don't have any pain. When I was in the hospital, I didn't need the pain medication. The only thing that they give you here pretty much is just the ibuprofen and you know, if I was in any type of pain, but I had no pain. So I am just so blessed with the way this is going for me. And again, I will go back and meet with my doctor about the pathology report to see how and the clearance of everything in there and the margins of, you know, removing all of the tissue from this breast. Yeah, so for 3 months, I'm definitely gonna be wearing this bra, and as time goes along, and we'll decide what's next. But the thing too is that we're still waiting on the BRCA testing to come back, and if the BRCA testings come back with me being BRCA1, BRCA2 positive, then we would have to look at the options of now removing the right breast and my ovaries. So I am truly praying that everything is good on that. And that is totally different from the cancer, because that is the genetic gene that I would carry in reference to the cancer coming back in another breast. And my ovaries. And I did ask for my right breast to be removed, but they were like, why are we going to mess with one other perfectly good breast? Because they said that it could cause more complications than needed. So the right breast could cause more complications than the left breast, when the left breast is the problem. So you know what, I sat with that for a moment, and I didn't like it, but you know, I dealt with it. And the thing about it is, you know, I asked her up front, I was like, well, could the cancer come back in the right breast? And she said, yes, it could, but it would be a different type of cancer. So I don't want that. So at the end of the day, I'm like, well, why don't we do the right one. And you guys, I asked this 5 times, 5 different ways, and I was told no each time. And I think this time I asked again in the hospital and I was told no. So I think that was 6 this moment. And I'm just so thankful again for everybody who is continuing to give the beautiful love vibes, words of encouragement, coming to my channel. And just for anyone who this is definitely going to help out in the long run, because that is the goal of what I am doing, to share the wealth and the knowledge, being the person who is the front runner before you, to give you the knowledge and the information that you may need or have questions about on your journey. So thank you so much again for coming by. If you haven't already, please, please, please subscribe, like, comment, ask me some questions. I can do a video on any questions that you have. We can interact through the comments or anything like that. So again, thank you so much for stopping by, and I appreciate you so much.